What caused your period to change after using the emergency birth control pill? Didn't it work? Well, watch this video where I explain the issues around abnormal or irregular bleeding after using the birth control pill. Hello everyone, welcome back to the channel. I'm Dr. Sylvia, a general practitioner and health educator. This is AskAwayHealth, where we provide you with clarity and direction about everything medical. Thank you for joining me today. Make sure you don't forget to subscribe and click the notification bell so that when we publish new videos, you'll be the first to know about it. Women take the emergency contraceptives in order to prevent an unplanned pregnancy, either after having unprotected sexual intercourse or if their contraceptive method has failed. But some of the questions we get asked often is, what has happened to my period? I used the birth control pill last month or 2 months ago and my period has never been the same since. Well, let's look at two main questions that tend to come up around the use of the emergency birth control pill. First, what caused your periods to change after using the birth control pill, or what caused a change in your bleeding pattern? And number two, if there was some difference in the bleeding that you experienced, does it mean that the pill failed? Should you take another one? What should you do? Presently, there are two main methods for emergency contraception. One of them is the emergency contraceptive pill tablets that you take by mouth, and the other method is the intrauterine copper coil device that's inserted into the womb. These pills or the coil can be used within hours or days of having unprotected sexual intercourse. Now, both of them can do something to change the menstrual pattern or a woman's cycle, but today in this video we're going to be looking at the effects of the birth control pill. Most of the emergency birth control pills are effective as soon as you take them following unprotected sexual intercourse. Some of them have an effectiveness window period, which means that the longer you leave taking them after unprotected sexual intercourse, the less effective they are. The most common birth control pills that we have today contain human-made or synthetic forms of the sex hormone progesterone that is produced by our ovary. Now, Levonorgestrel, that's the name, that is used in the birth control pill, needs to be taken within 72 hours or 3 days of unprotected sexual intercourse in order to be effective. The longer you leave it, it is less effective. So as soon as you take it following unprotected sexual intercourse, Levonorgestrel is most effective. Now, this is the case whether you're taking just one tablet or pill of Levonorgestrel or whether you're taking two different pills 12 hours apart. Levonorgestrel works by delaying ovulation, that is the release of an egg from the ovary. Common brands that contain Levonorgestrel are drugs like Postinor, Postinor 2, Postpill, Levonelle, Plan B 1 Step, MyWay, Take Action, etc. They all contain Levonorgestrel. Another type of emergency birth control pill prevents our natural progesterone from working properly, and in that way it also results in delaying the release of an egg from the ovary. This pill contains Ulipristal and can be used for up to 5 days, that is 120 hours after unprotected sexual intercourse. It is also sold as Ella or EllaOne commonly around the world. In some countries, they use some forms of the regular combined oral contraceptive pill as a form of emergency contraception, although some studies suggest this is less effective than using Levonorgestrel the way we do in things like Levonelle or Postpill. In some other places, another form of emergency contraceptive method is the use of the drug mifepristone, which is also used for induction of labor. So, the most common of the emergency birth control pills that we have either contain the human-made or synthetic forms of the natural hormone or agents that work against the hormone, the end result preventing the release of the egg from the ovary, which naturally will lead to changes in the bleeding pattern. And therefore, when you take the emergency contraceptive pill, there are some side effects that you might experience when it comes to bleeding that should not alarm you. Number 1, that your menstrual period may arrive earlier than its expected date. Number 2, that the next period you have after you've taken the emergency contraceptive pill may be a heavier flow than usual. And number 3, that your period may come later than its expected date. Now let's look at some of the things that happen when you take the emergency control pill. First, a couple of facts. A cycle is the period of time between one menstrual period to another. In most women who we say have regular cycles, this is a 28-day period, although it could be a little bit less or it could be a little bit longer. And the second fact is that following sexual intercourse, it is possible for the sperm to remain viable in a woman's reproductive tract, i.e. the womb or within the tubes, for up to 5 days. And another fact that you should remember when you use the emergency control pill is this. After you've used the pill once in a cycle, there is an increased risk of falling pregnant later on in that cycle when you have sex if you do not use emergency protection or do not have a regular contraceptive method in place. This is why the recommendation is to have regular contraception if you're sexually active and are not yet prepared or do not want an unplanned pregnancy. So please bear this in mind. The emergency birth control pill that you take today for sexual intercourse that you had yesterday is not going to protect you from pregnancy for any sexual activity you have the following day or subsequently. With each encounter, with each sexual encounter, your body as a woman receives another load of sperm that is viable for an extra day. So if you're having sexual intercourse every day following the use of your last pill, with each episode of sex, you have sperm that are viable for another day longer, and another day longer, and another day longer. Now, when you take the emergency contraceptive pill after sexual intercourse, ovulation is delayed for 5 days until sperm from that sexual activity are no longer viable. The process of delaying the release of the egg is what leads to the changes in your pattern and explains why some women may bleed earlier or later or have a change in their bleeding flow. These changes are also more likely to happen if you take the emergency birth control pill more than once in a cycle. Although we know it doesn't cause any significant harm and will continue to delay ovulation, frequently using the emergency contraceptive pill in one cycle is likely to lead to irregular bleeding and frequent bleeding episodes. And do we have any analysis on the proportion of women and how they experience bleeding abnormalities? Yes. Some of the studies show that the majority of women, up to 70 or 75%, will have a menstrual period within 7 days of their expected period. So that's normal, nothing much to worry about there. In 10 to 20% of cases, depending on the type of pill, these ladies will experience a period that is more than 7 days late. Among the group of women who experience delay in their periods coming, up to 4% experience delays of up to 20 days, that is 3 weeks, before their period eventually arrives after using the emergency birth control pill. A very small percentage of women using the birth control pill may find that their periods come earlier than the due date. And what about the next question that we wanted to address in this video? Can you use your bleeding pattern on the pill to indicate whether or not it's worked? No. The best way to check whether your emergency birth control pill has worked or not is simply by keeping track of your dates. What date did you take the pill? And what date do you expect your next period? They're really important rules of thumb to follow when you're taking or using the emergency contraceptive pill. Do a pregnancy test if your period is delayed by more than 7 days after the expected date of that month's period. 2. Do a pregnancy test if the next period that you have appears lighter than usual. And 3, do a pregnancy test if you experience abdominal or pelvic pain that is different. It might be more severe or more intense compared to your usual period cramps or menstrual cramps. Okay, what have we learned? That the expected side effects you can get from using the emergency control pill does include some form of irregular bleeding. They can be your periods coming a little bit earlier or your periods coming a little bit later than usual, and it may also come with heavy bleeding. Number 2, this is probably more likely to happen. This irregularity or alteration of your pattern is probably more likely to happen if you're using the pill, emergency contraceptive pill, more frequently in one cycle. Also, please remember, bleeding after sex or bleeding in between periods should never ever be ignored. Speak to your doctor. Sometimes symptoms like this may suggest serious conditions, for example cervical cancer, so never disregard them. If you'd like to learn about the causes of vaginal bleeding after sex, check out this video here. I'll also place a link to the video in the description box below. Please keep in mind, the birth control pill does not protect you from a sexually transmitted infection. STIs are another cause of irregular or abnormal vaginal bleeding, so it's really important to consider this if you're having unprotected sexual intercourse. Thank you so much for watching, guys. I hope this video has been informative and helpful. Do let me know in the comment section below. You know, I'd love to hear from you. If you've got any questions on this topic or other related areas, I cover issues around women's health and reproduction, contraception. Don't forget to like the video and share with a friend. Subscribe to my channel, and until next time, stay well.